Welcome back to The Deep Dive, where we take a critical look at the sources you need to be truly well-informed. Today, we are tackling a topic that haunts every athlete and really anyone who's ever had a nagging injury. We're talking about muscle scar tissue. If you've ever dealt with an injury that just won't seem to get its strength back or its flexibility, you know exactly what we mean.
We do. We're diving deep into muscle fibrosis, which is, the scientific term for it. And the mission today is to cut through decades of, conventional wisdom and, frankly, a lot of myths that surround recovery.
Right. It's about shifting the focus.
Exactly. We're using sources like effective strategies for managing scar tissue and muscles to completely shift our focus.
Okay, so we want to start talking about the impossible, which is this idea of physically trying to, rip out or eliminate the scar tissue.
Yes. The goal is to focus on what's actually achievable and what the evidence supports, which is functional management and remodeling. The core tension here is that scar tissue is necessary. It's a natural, rapid response by the body. It's there to patch a hole after an injury.
It prioritizes speed over quality.
That's the perfect way to put it. Speed over quality.
Yeah.
But for you, the active listener, that quick patch becomes a huge long-term limitation. It restricts flexibility, reduces force, and critically, it makes that muscle so much more likely to get injured again later on.
Okay, so let's unpack that. If the body is just, doing its job and laying down this patch, why does it become such a crippling performance problem? What is the science actually telling us about this dense collagen network?
Well, it all comes down to architecture.
Architecture.
Yeah, architecture. Normal, healthy muscle tissue is built for alignment. Think of it like 100 perfectly organized ropes, all running parallel, designed to pull together in the same direction. Super efficient.
Okay, I can picture that.
Muscle scar tissue, though, is what happens when the body creates that dense collagen network very, very quickly. Our source calls this repair process normal but not perfect.
And when we say normal but not perfect, are you saying the body is it's choosing speed over making a good repair?
Exactly. And that imperfection is purely structural. Research confirms that this excess collagen leads to significant structural disorganization. So instead of those neat parallel ropes,
you get a mess.
You get a dense, chaotic weave, a jumbled mess of collagen fibers running every which way.
That makes sense physically, but what does that chaos mean for me when I'm, say, trying to make a quick lateral cut on the court, or I'm at the bottom of a heavy squat? Is it just weakness, or is there something else going on?
It's both. The mechanical consequences are immediate. That disorganized patch, it significantly reduces elasticity, just drives up the overall stiffness of the muscle.
So it's like having a big knot of glue in the middle of a rubber band.
That's a great analogy. If you try to stretch that muscle, it resists because that glue-like structure is fighting the stretch. The muscle is less springy, it's less reactive, and it takes way more energy to produce the same amount of force.
The physical limitation is clear, but the source also suggests a biological barrier, which, that's fascinating. How does that dense collagen actually interfere at a cellular level?
This is where it gets really critical for those chronic nagging injuries.
Yeah.
The fibrotic tissue isn't just taking up space, it actively gets in the way of your muscle stem cells.
And the stem cells are the good guys.
They're the elite construction crew. They're ready to regenerate high-quality, perfectly aligned muscle tissue.
And the scar tissue is blocking them.
Precisely. It's like having a broken-down truck stuck right in the foundation of your construction site. It slows down any proper organized muscle regeneration. It ensures that the repair job stays substandard, and it traps the muscle in this lower functional capacity.
And that's what sets you up for getting hurt again.
That's the cycle. Your muscle's less efficient, less responsive, and just fundamentally vulnerable because that high-quality repair never really got a chance to happen.
So if this scar tissue is this, dense, organized, and chemically aggressive barrier, that begs the question, what do we do about it? And I think this is the part a lot of people who've gone through rehab really need to hear, because it's a huge shift in perception.
I agree. We've all seen the images, maybe even felt it ourselves. A therapist applies this deep pressure, or they use those stainless steel instruments, and it hurts a lot.
The good pain.
Right, the good pain. The common idea is that this intense feeling means we are actively breaking up or eliminating the scar tissue.
Is that realistic, though? Is that, ouch, that hurts so good, feeling the sound of fibers snapping apart?
Okay, so this is the crucial truth we need to get across. The vast majority of these popular intensive manual treatments do not eliminate or structurally break up scar tissue.
At all.
You cannot manually erase years of laid down collagen. It's not physically possible.
Okay, but then if these techniques are only temporary and they don't change the structure, why are they the gold standard in so many clinics? I mean, isn't there an argument that even a short-term improvement is good for breaking a pain cycle?
That's the nuance, exactly. The goal of these therapies is much more functional and achievable than demolition. They aim to improve tissue mobility, to reduce painful symptoms through sensory input, and to enhance your range of motion.
So it's about helping the muscle function better.
So that you can move forward with the active part of rehabilitation. The pain you feel is sensory input. It's not structural demolition.
Let's get specific then. Let's look at the evidence. What about instrument-assisted soft tissue mobilization, IASTM? We're talking about the Graston technique, right? Those steel tools.
Yes. Research does support that IASTM can give you short-term improvements in pain, in flexibility, in range of motion. We see strong evidence, for instance, for quick improvements in hamstring flexibility. So that benefit is real.
But the critical limitation is what?
The research is very clear that these techniques do not physically break up the underlying fibrosis. They increase blood flow, they modulate pain signals, and they temporarily improve the glide between tissue layers, which gives you a better window to move.
One window.
A window. But the structural benefits are temporary if you don't follow up with active work. It's a powerful tool, but it's not a surgical eraser.
That completely changes how you should view those tools.
Okay.
What about the gentler stuff? Basic massage, focused stretching.
Both essential supportive techniques. They're excellent for reducing stiffness, improving comfort, enhancing overall mobility, but
There's a but.
there's a but. The consistent takeaway from the research is that there is no strong evidence they physically remove the scar tissue itself. They manage the symptoms, which is incredibly valuable, but they aren't the primary solution to the underlying collagen structure.
Okay, before we get to the playbook, let's just quickly run through a few others we see advertised all the time. Dry needling, ultrasound, laser.
Sure, dry needling is promising, but the evidence is inconsistent. It seems to help reduce tightness, improve mobility in the short term, probably through some local neurological changes, but it is not a definitive treatment for fibrosis.
And ultrasound and laser.
Very mixed research. Some studies show small, temporary thermal effects. Many show no significant benefit at all when it comes to remodeling fibrosis. They should be considered optional add-ons, never the main event.
So if we accept that just hitting it hard doesn't break it up, that leads to the logical next question. If the scar tissue is still there, how do we functionally move around it? And maybe more importantly, remodel it. Let's talk strategy.
Let's do it.
This is a huge mindset shift. We need to go from this passive idea of being treated to active functional management. The core idea is that the body rebuilds based on demand, right?
That's it, exactly. The functional playbook is all based on one concept. Scar tissue is not static. It remodels itself based on the mechanical load and the specific activity you put it through. You can actually teach that chaotic collagen network to realign itself.
Okay, so let's talk strategy 1. This sounds like the engine of recovery.
It is the primary driver.
Yeah.
You have to combine load and movement. This means progressive strengthening combined with controlled, full-range movement. And when we talk about progressive load, we are really emphasizing eccentric loading.
The lengthening phase.
The lengthening phase of a muscle contraction, yes.
Why eccentric loading specifically? What's so special about that?
Research shows that eccentric work is critical for realigning disorganized collagen fibers while they're under tension. It is the single most effective way to mechanically stress that tissue and encourage new collagen, and even the existing stuff, to lay down in that proper parallel orientation that healthy muscle needs.
So without that specific kind of tension,
that scar tissue will stay disorganized and weak, period.
Which puts all that manual therapy we just talked about squarely into strategy 2.
Precisely. Strategy 2 is using manual therapy as an adjunct. These techniques are not the fix, they're height. They're like the oil change you get before a long road trip. They improve short-term mobility, they reduce stiffness.
So you can train better.
They create that window you need to do the hard functional work from strategy 1, that heavy eccentric loading, more effectively and importantly more safely.
Okay. And strategy 3 covers the maintenance, the day-to-day work.
Strategy 3 is consistent mobility. This is your daily insurance policy. You have to proactively maintain tissue glide and reduce general stiffness. Regular foam rolling, dynamic stretching before you train, joint mobility work. This prevents that remodeled patch from just tightening up and becoming a problem again.
We focus so much on movement, but the body needs building materials to remodel tissue. That brings us to strategy 4, nutrition.
This is so often overlooked. Strategy 4 is prioritizing nutrition because we are asking the body to build new high-quality collagen and rebuild muscle fibers. You have to give it the raw ingredients.
Which ones are absolutely non-negotiable for this process?
The essentials for collagen support are adequate protein, vitamin C, and zinc. Protein provides the amino acids, the basic building blocks. Vitamin C is crucial because it's a cofactor in the process that allows collagen strands to cross-link properly and form a strong, stable structure.
A triple helix, right.
Right. If you're deficient in vitamin C, your new collagen will literally be weaker.
So just taking a collagen supplement might be useless if you're not pairing it with enough vitamin C.
Absolutely. They work as a team.
Yeah.
Some protocols even suggest taking about 10 grams of collagen with vitamin C, maybe 30 to 60 minutes before a loading session. You're basically flooding the system with the building blocks right when you apply the mechanical stress.
And don't forget zinc.
And don't forget zinc. It plays a huge role in enzyme function during the repair and inflammatory phases. If you skimp on any of these, you are compromising the quality of the new tissue you're laying down.
And finally, strategy 5 is about putting it all together with an expert.
Consult experts. That's the final step. Work with a qualified PT or a sports clinician. They're trained to assess how chronic or severe the fibrosis is, and they can design a truly personalized plan that applies strategy 1, the right eccentric loads, the right mobility drills, the right volume for your specific functional demands.
So a program for a distance runner looks very different from one for a power lifter.
It has to. It has to be tailored to your sport, not just some generic rehab sheet. This whole shift in mindset, from expecting a therapist to fix you, to understanding that you must actively remodel yourself through load and nutrition. It's incredibly empowering.
Okay, so to synthesize this whole deep dive, what we've learned is that muscle scar tissue, or fibrosis, it's a natural but dense and disorganized collagen patch. And it actively interferes with your body's best repair mechanisms, limiting elasticity and increasing your risk of getting hurt again.
And we deliver that crucial distinction. Manual therapies like Graston, they don't eliminate the tissue, they just provide a short-term window of mobility.
A window that enables the real work.
Which is functional loading. And the long-term strategy for managing it all hinges on remodeling. It means using massage or ISTM as an adjunct, but prioritizing strategy 1. Progressive eccentric strengthening to teach that collagen how to realign itself.
And we also emphasize the foundational role of nutrition, protein, vitamin C, zinc, to make sure the material your body is using to rebuild is top quality.
So here's the final thought for you to carry forward, and this is based on research from back in 2015. Since muscle scar tissue formation involves this continuous imbalance between collagen being produced and being broken down, the real question for your long-term health isn't whether you can remove old, compromised collagen. The question is, are you currently optimizing the environment through controlled eccentric load and targeted nutrition to ensure that all of your future collagen is laid down as functionally as possible? What adjustment can you make to your training or your diet today to support that optimal tissue remodeling?